I'm Dr. Samuel Acuff. I'm a research scientist at the Recovery Research Institute in the Department of Psychiatry at Massachusetts General Hospital. Today, we're going to be talking with Dr. Emily Hennessy, Associate Director of the National Center on Youth Prevention, Treatment, and Recovery. How's it going?
Good. How are you doing, Dr. Acuff?
I'm doing well. Thanks for asking. What ages, we're going to talk a little bit about youth recovery today. And before we even get started, what ages fall into youth recovery?
Yeah, so adolescents and young adults would kind of both be considered in that bucket of youth and recovery. And if we think about adolescents as ages kind of 12 to 19, although 12 seems really young to be thinking about treatment and recovery, we do see young people in that age range enter treatment and recovery spaces. And then for young adults, we like to think about kind of 18 to 25, although oftentimes if we're talking about some types of recovery support services, then we would think about young adults kind of extending up to ages 30.
I see. So it could be 12 to 30, but 12 to 25, definitely. And why focus on adolescent youth and emerging adults sort of as a unique population for when talking about recovery?
So developmentally, this is a really unique population. If we think about where they are kind of in their life stage across a variety of domains, there's a lot of changes going on biologically, physically, neurologically, socially as well. So they're in this space. Oftentimes, if we think about kind of younger adolescents, they're living with their families and they're children of parents, right? And so their parents are still kind of expected to be providing monitoring and oversight, but the young person is gaining more independence as they're growing older. But they're not yet adults. So there's lots of parts about their self-regulation and skill regulation and social functioning that are kind of adapting and changing. This is a time when they're really thinking about who they want to be in the world and what that looks like. And that will change depending on who they're interacting with. So they're looking outside their family around who they are. Up until the adolescent period, they were really kind of thinking about themselves as within the family unit, and that kind of defined who they were. But as they start to kind of engage in spaces beyond their family, they're interacting with other people that have maybe other behaviors, especially behaviors around substance use, and those are kind of informing how they think about substance use. And that just kind of continues into this young adult phase where until kind of early adulthood, that's when the social identity and personality development, things like that are more fully formed. So it is a really unique space because of those developmental considerations and a lot of the community contexts and settings that go along with what's going on during these phases.
I see. So you can't really take research that's being done with adults and apply it to adolescents or emerging adults and expect it to be the same. So what kind of unique considerations, when doing research in this population might need to be considered?
There are a variety of considerations. Well, the first one, and you kind of nailed it with your response, is that adolescents are not simply miniature adults, right? Young adults aren't miniature adults. They're in this unique developmental phase, and they have these considerations. And they're also persons in and of themselves. So when doing research with young people, it's really important to bring that into that conversation about what's going on. In my work and others at the Recovery Research Institute, we really value and prioritize qualitative research, which means sitting down with someone and asking them about their thoughts around treatment, substance use treatment and recovery, and what that looks like for them. And so those kind of considerations, and that if you're going to be doing research with young people and also kind of working with them clinically, you really want to take them in as a partner into that conversation, into that experience, and value what they're kind of sharing with you. And not just assume that because you do have that degree or clinical background or experience that you know everything about their situation or what they're bringing to it, but they have just as much value in sharing that with you. And that's a really important developmental consideration. I think the other piece, especially if we're thinking about young people that are minors, is really how the family interacts and engages with the young person and how that influences their treatment and recovery supports. And oftentimes, what can be challenging is really thinking thoughtfully about how to bring a family into that conversation, and also to recognize like where the family may be very supportive and where there may be some barriers because of the family environment to the young person. And so it's kind of teasing out in what ways the family can increase their supportive skills around parenting a young person in recovery or supporting a young person in recovery, and where the young person may need to identify additional supports, additional kind of trusted adults in the community or other folks in recovery that can support their recovery process.
So what kind of research is being done in this space of youth recovery?
So, the Recovery Research Institute has several studies that are ongoing to examine youth treatment and recovery, primarily focused with young people kind of in the ages of 12 to 19. Some of my own work is examining youth recovery capital, which are resources for recovery, and how that changes over time and it interacts with changes in their social networks. We also have some research ongoing that looks at how to improve the kind of treatment and support monitoring within a recovery high school, and whether or not there are electronic methods of engaging with the school and with the students that can kind of help the school staff engage further. And then we also have a newer study that's just starting up that aims to examine the effectiveness of adding 12-step facilitation. So 12-step mutual help groups are in the community. There are lots of them available nationally, and some are available for young people. And what Dr. Kelly's research has demonstrated previously is that for young people who are able to engage in those groups, their recovery journey goes much better. They have improved outcomes. But alternatively, it's really difficult to get young people engaged in 12-step groups in their communities. And so this study in particular is going to seek to link young people through a treatment program with 12-step meetings in the community and see if those young people do better than youth that are just in the treatment without this 12-step facilitation. So there's a variety of studies that are looking at both kind of just examining how young people do over time in their recovery journey, as well as looking to improve our current intervention, programming, and community recovery support landscape.
Yeah, comprehensive program of research going on there at the Recovery Research Institute and the National Center on Youth Prevention, Treatment, and Recovery. Thanks for chatting with me today.
Thank you, Dr. Acuff.